Your grandmother just had hip replacement surgery. The operation went perfectly. But now, 12 hours later, she doesn't recognize you. She thinks she's at home. She's seeing people who aren't there. The doctors call it postoperative delirium, and it happens to up to 50% of elderly surgical patients. This isn't a rare complication. It's not a medication error. It's your brain's defense system misfiring under extreme stress. And the terrifying part? It can permanently damage cognitive function, accelerate dementia, and double the risk of death within 1 year. But here's what most people don't know: it's largely preventable. Let me show you what's really happening. When elderly patients undergo surgery, their brains face a perfect storm of threats. Anesthesia chemicals flooding neural pathways, inflammatory molecules crossing the blood-brain barrier, blood pressure fluctuations reducing oxygen to critical brain regions, pain signals overwhelming cognitive processing, sleep deprivation dismantling the circadian rhythm. It's like throwing a computer into chaos mode, except this computer is your consciousness. The brain region most vulnerable is called the prefrontal cortex. This is your command center for attention, orientation, and logical thinking. In older adults, this region already operates with reduced reserves of neurotransmitters, like acetylcholine and dopamine. Surgery pushes it past the breaking point. Suddenly, the brain can't maintain basic functions like knowing where you are, what day it is, or who people are. That's delirium. But why are elderly people so vulnerable? It comes down to something neuroscientists call cognitive reserve. Think of it as your brain's backup battery. Throughout life, education, physical activity, social engagement, and mental stimulation build up this reserve, but aging depletes it. By age 75, many people are running on minimal backup power. Then surgery hits like a massive power surge. The system crashes, and there's another hidden culprit: muscle loss. When patients lie in bed for days after surgery, they develop something called ICU-acquired weakness. Within just 5 days of bed rest, elderly patients can lose up to 30% of their muscle strength. You might think, so what? That's just physical. Wrong! When your body can't move, your brain loses critical sensory input. The vestibular system that controls balance stops sending signals. Proprioceptive receptors in joints and muscles go silent. Visual and spatial processing networks shut down. Movement isn't just physical therapy, it's brain therapy. Here's the cascade: immobility leads to sensory deprivation, which triggers confusion, which makes cooperation difficult, which leads to more immobility. It's a death spiral for cognition. Research from The Lancet showed that patients who received early physical therapy during mechanical ventilation had their delirium reduced from a median of 2 days to 0 days. Just by moving. But movement is only part of the solution. The other part is sensory stimulation. Imagine being in an unfamiliar room with no clock, no calendar, no familiar faces, no glasses, no hearing aid. You're in pain. The lights are on all night. Strange machines are beeping. You just had major surgery and you're on powerful medications. Your brain is desperately trying to make sense of this chaos, and it fails. That failure is delirium. Hospitals discovered something remarkable, simple. Environmental modifications can cut delirium rates by 40%. Put a clock where patients can see it. Give them their glasses and hearing aids. Turn lights on during the day and off at night. Have staff repeatedly orient them. Good morning, Mrs. Johnson. It's Monday, August 5th. You're in City Hospital recovering from your hip surgery. These tiny interventions anchor the brain to reality. There's a comprehensive program called Help Hospital Elder Life Program that packages all of this together. It includes orientation protocols, sleep enhancement, early mobilization, vision and hearing assistance, hydration, nutrition, support, and cognitive stimulation. Hospitals that implemented HELP saw delirium rates drop by more than 40%, not with medications, with systematic environmental and behavioral support. The medication angle is crucial too. Many elderly patients are on anticholinergic drugs for allergies, stomach issues, or sleep. These medications block acetylcholine, the exact neurotransmitter. the aging brain desperately needs for attention and memory. Adding surgical stress on top of anticholinergic medication is like removing the last support beam from a collapsing structure. Pharmacists reviewing medication lists before surgery and discontinuing unnecessary anticholinergics can dramatically reduce risk. Sleep is another underrated factor. Research from UC Berkeley found that adequate sleep reduces amygdala reactivity to fear stimuli by 60%. After surgery, patients are awakened constantly for vital signs, medications, and monitoring. Their REM sleep, the phase that processes emotions and consolidates memories, is shredded. Without REM sleep, the brain can't regulate emotional responses or maintain cognitive coherence. The result? Delirium. Now let's talk about what happens after someone survives delirium. You'd think once they're oriented again, everything is fine. Not true. Studies show that patients who experience postoperative delirium have double the rate of cognitive decline 1 year later. The inflammatory damage, the neural stress, the extended period of confusion, all of this leaves lasting scars on brain tissue. Some patients never fully recover their pre-surgery cognitive baseline. This is why post-discharge care is critical. The same principles apply at home. Maintain routines, ensure sensory aids work, provide social interaction, continue physical activity, avoid sedating medications. Home health physical therapy focusing on walking, balance, and functional tasks keeps the brain engaged. Adult day programs provide cognitive stimulation and social connection. These aren't luxuries. They're neuroprotective interventions. Technology is starting to help too. Tablet-based cognitive training programs can provide memory games, attention exercises, and orientation tasks right from the hospital bed or living room. Virtual reality environments can simulate familiar home settings to reduce anxiety and provide spatial orientation cues. AI systems are being developed to predict delirium risk by analyzing electronic health records, allowing preemptive interventions for high-risk patients. But the most powerful tool remains the human touch. Multidisciplinary teams, doctors, nurses, physical therapists, occupational therapists, pharmacists, nutritionists, and families working together with clear protocols. When everyone knows their role, when mobility starts within 24 hours, when sensory input is optimized, when medications are reviewed, when families provide familiar voices and faces, delirium rates plummet. Here's the bottom line: your brain didn't evolve to handle anesthesia, surgical trauma, and ICU environments at age 80. It needs help. It needs movement to maintain sensory integration. It needs temporal and spatial anchors to maintain orientation. It needs sleep to consolidate memories. It needs familiar stimuli to feel safe. It needs nutrition to fuel neurotransmitter production. And it needs time to heal without additional insults. If you or a loved one is facing surgery, here's what you can do. Before surgery, optimize cognitive reserve, stay physically active, socially engaged, mentally stimulated, review all medications with a pharmacist, bring glasses, hearing aids, familiar photos, a calendar, and a clock to the hospital. After surgery, advocate for early mobilization. Request orientation protocols, ensure day-night light cycles, minimize sedating medications. And once home, maintain structure, activity, and social connection. Postoperative delirium isn't inevitable. It's preventable. And preventing it isn't just about avoiding confusion for a few days. It's about protecting brain function for years to come. It's about maintaining independence. It's about preserving the person you love. If this video helped you understand delirium prevention, please hit that like button and subscribe to the channel for more evidence-based health information. Your support helps us reach more people with science that can genuinely improve lives. Thank you for watching. And remember, when it comes to surgery and aging brains, an ounce of prevention is worth a pound of cure. See you in the next video.